All right. Hello. Thank you all so much for allowing me to come and speak. Again, my name is Cindy or Cynthia Lurie. I am an occupational therapist and have been for over 30 years now. I have always worked with the older adult population in those 30 years. Occupational therapy, for those of you who don't know, we are the ones who work on all those things we take for granted until they're difficult to do. The ADLs, bathing, dressing, toileting, how do you get to the toilet, how do you get in and out of your shower, in and out of your bed, to be able to do all of those functional tasks that you want to continue doing. I do own a company called Enable Home Solutions. I go to people's homes, make objective recommendations about what you or your loved one needs to decrease fall risks and maximize function in your home. With my big focus is decreasing fall risks, and that's why I'm speaking tonight about one portion of that. And I'm going to try to talk actually a lot less than Amy. So Amy is going to be focusing on balance and what that means and exercise. I'm going to talk a little bit about falls. I have to give the bad news. And then a little bit about home modifications to decrease those fall risks. But I'm just going to be talking a little bit about it today. If you have other questions, you can come up to me afterwards. But we're going to focus on, first of all, falls. The aging process and falls. There are things that happen to all of us as we age, and every single thing that happens to us as we age, although varied in severity and in timing, every single thing increases our risk for falls, okay? That includes changes in vision and hearing, changes in balance, flexibility, and strength, changes in memory and cognitive function. You have most likely have an increased use of medications. So is there medication side effects, or is there polypharmacy, which just means multiple medications that maybe are working against each other? There's an increase in diagnoses that all can affect mobility, and those include Parkinson's disease, arthritis, diabetes, dementia, stroke, just to name a few. But all of that being said, is falls should never be considered a normal part of aging. Just because everything that happens to us as we age increases our risk, that does not mean that we should just normally fall and think nothing of it. Okay? According to the CDC, more than 1 out of every 4 people over the age of 65 fall each year. 3 million older people are treated in the ED, that's the emergency department, for injuries sustained from falls. It is the most common cause of TBI, that's traumatic brain injuries. 1/4 of seniors who fracture a hip from a fall will die within 6 months of that injury. So falls are serious. More than half of those falls occur in the home. The cost in general of falls is staggering.
That's funny.
Oh, it didn't come up. Oh.
Cost is falling off a cliff.
It fell out. Did it fall? It fell off a cliff. There you go. $500 billion a year is spent in the medical costs of falls. The majority of that is borne out by Medicare, but it's still $500 billion, and that is only the medical costs. That does not include the costs of the daughter who had to take off work to come and be with mom. It does not include all of the caregiving assistance that may be needed after returning home from the fall. And if anybody has dealt with caregiving assistance, hired, Medicare does not pay for caregiving assistance. That's huge cost. So the $500 billion is only the medical costs, the acute care costs of falls.
Thank goodness Medicaid covers all that. Whew, so last one to pay for that.
Yeah, Medicare only covers the medical part. So Yeah, it keeps falling off. All right, so you have the financial, but then you also have the social emotional costs of falls. Falls can change how we view moving. If a loved one has fallen, falls frequently, or sometimes just one time, but it was a bad one, there is an increased risk, an increased fear of falling again. So what does someone do usually when they have a fear of falling? They stop moving because they're scared of falling. And then we know that stopping moving is going to increase our risk for falls even more. So it's a real vicious cycle, or it can be. All right, that was a lot of negative stuff. So there are lots of things we can do to decrease our risks for falls. Number one is to stay physically active, including strengthening and balance exercises, which this is going to be the focus of what Amy is going to talk about. But other than that, it's also very important to have your vision and hearing checked regularly, and then follow up with the recommendations provided for the vision and hearing. You should learn about the side effects of medications and discuss possible polypharmacy with your doctor, or just really have an understanding of what those side effects of your medications are. Get enough sleep. The studies have shown that is a real increase in focus is sleep and the importance of sleep. So a lot of actually what I work with people on when I do go into the home is to make sure that whatever sleep patterns, the process of sleep, that we really address those things. Are we getting up too often to use the bathroom and that's decreasing sleep? I have a gentleman right now who gets up 3 times a night to use the bathroom, but the process he was going through to get to the bathroom to and from safely with his Parkinson's disease, he was up for far too long and completely wide awake for that, each time taking 30 to 45 minutes because the process he was doing was far too extensive. So we worked on decreasing that time needed for him by changing some lighting and talking about some other methods of getting in and out of bed. So we really want to focus on increasing sleep and improvement in sleep patterns. A little reminder, and my husband is actually a cardiologist, and he actually reminds his patients to do this as well, that before you get up, if you have any history of orthostatic hypotension, that means your blood pressure drops when you stand up, and this can be a side effect of medication or a side effect of certain diagnoses that you may have or a loved one may have. I remind people that before you stand up is just to pump your ankles a little bit, move your legs around a little bit, and then before you stand up, and then stand up and wait 3 to 5 seconds before moving, okay? That way, if you do get dizzy, you can sit right back down, because lots of falls are caused by that dizziness, and you've run to the doorbell that's ringing, and you've fallen along the way. So, and then be evaluated. I do, yes, I'm a therapist, so I am partial to recommending physical therapy when there are balance strengthening issues. If a doctor has said, oh, maybe you should just be using a walker, I would actually, or someone has said that to your loved one, I would actually say, you know what, can you give me a physical therapy referral so the PT can actually tell me what assistive device I may need. So I do recommend getting that PT evaluation. The other thing is to look at your environment. So a person's environment should help versus hinder their inevitable aging process. There is no reason that the environment, we already know we're going to age. We've already gone through all that. No one is getting better as we age, right? So we know there are issues. Let's have the environment help in that process and not be a hindrance to the process. Modifying or improving the home environment with a person's fitting for a person's cognitive and physical needs in mind can enhance and maximize a person's function and independence and decrease fall risks. So, I'm going to talk just a little bit about modifications. I'm not going through, oh my gosh, I could talk an hour just on all the modifications that you can do in a home. I'm going to focus today on things that really aren't helpful, and then more do-it-yourself kinds of things that you can think about in your home now. But number one, not all modifications are helpful. Okay, so something that worked for your neighbor's husband does not mean it'll work for you. Kind of the same concept as the stair lift that maybe was great in one home, that does not mean it's going to fit your stairs. So the two obvious ones are those ramps. They are not helpful whatsoever. The bed rail also, I get this question all the time, is they're afraid of their mom falling out of bed, we'll just put a bed rail up. So somebody with a little bit of confusion in the middle of the night may just climb right on over that, and that means now they have a higher, fall, a harder and higher fall, or they get stuck within it. So do not recommend that. I usually recommend some other ways of modifying the bedroom, whether it's lowering the bed, putting a mat by the bed, something for nighttime, an alarm to let loved one know when they're about to get up, lots of other things, but that is not a helpful modification. Home improvements do not have to look industrial, ugly, or like you're in a hospital, okay? One grab bar may be great. That does not mean you need 4 of them in the same spot. And the other bathroom over there, that is not the way we modify. First of all, that's ugly. But secondly, they've just added equipment there that actually increases fall risks also, because there's way too many legs in a very small space. So, there are lots of options out there now for equipment, and some of them actually really nice. You can get grab bars that fit your aesthetics. You can get equipment that kind of blends in. So things do not have to look industrial or ugly. All right, so some helpful do-it-yourself hints that's going to address these issues, right? We want to avoid those stepping on the stool. This bed, far too high for most people, right? We usually get shorter as we age. Getting in and out of a high bed can really cause a lot of fall issues at night, especially tripping over things, right? Bathroom. Just bathrooms in and of itself, wet surfaces, getting in and out of a tub, lots of fall issues there. And then if you see, can you even tell those are stairs? Yeah. So a couple things with the stairs, right? Number one, our depth perception decreases as we get older, along with just our visual acuity. If I was standing at the top of those stairs and looking down, I couldn't tell where one stair stops and one starts. So we'll talk a little bit about that, things that you can do on your own to address some of those issues. Okay, so number one, remove clutter. That means removing clutter, including furniture that may be in the way. I really can't say enough about the idea of downsizing, even if you are going to stay in your home and not even thinking about moving. Downsizing and starting to get rid of things that there's a lot of benefit to that. Number one, it does decrease fall risk, so you're not reaching around things to get to this. You're not spending far too much time searching for things. You're not putting newspapers on the floor. You're not going around if you're using a walker, but then this area you can't even get the walker through because there's a couch in the way, or the coffee table. I see that all the time. People using a walker, but they have to leave it off to the side because they have a coffee table sitting right in front of their couch. So we need to think about how things are set up, remove clutter, remove furniture that's in the way. Yes. Remove throw rugs. But that's different than area rugs, right? I'm not totally against area rugs, right? We know the difference. Throw rugs tend to be a little slipperier. There's no furniture on them holding them down. That's different than area rugs. Big rug in the middle of the living room, has furniture over it, hopefully not too thick. You can just do carpet tape around to secure all the edges of your area rug, so you don't have to always take that up. But and then just a non-slip mat outside the shower. So we want to avoid those stools, right? Avoid climbing on the stools. The way we do that is to really think about how we're arranging our kitchen. That tends to be where we use the stool. So rearranging the kitchen, think about what you're using the most and make sure that those things are accessible. Consider adding some pull-out shelves if you're really having to reach inside a deep cabinet. You can get pull-out shelves very easily from Amazon, from Container Store. That makes it a whole lot easier to find things, so you're not getting down on the ground or having to reach up way high trying to find things. So the stairs that we talked about, right? Adding lighting. Also really easy to add some very simple lighting around the stairs, making sure that lights can be turned on from the top and the bottom. Adding some non-slip treads, so visually you can see where one stair stops and one starts. Also decreases the slipperiness of the stairs if you have those non-slip treads. And then a handyman can easily add handrails. Many houses I go into have one handrail. It is easy for a handyman to come in, they just match. Right? They'll come in and look at what you already have and then try to match it so you have a second handrail along the stairs. Those are things that are relatively easy. And then what I will say about stairs in general is if you have stairs more than one or two to get into your home, and if you have stairs to where you have to go upstairs for your bedroom or your bathroom, please make a plan now, before a crisis occurs. Just know in your head, the minute I can't do my stairs, I'm moving. Great. Then you know, and you can start that process to maybe go and hire one of the wonderful companies that will take you around. You can figure out where you may want to go. You can start to downsize your house now so that it's not left up for when you're in that crisis moment and need to move. Make your plan now. I have seen way too many people who don't make that plan. A crisis occurs, and now they can no longer take a shower because they are stuck on their main level and cannot get upstairs. And there's only a half bath on the main. So make your plan and then start to follow through with that plan. And then if it's one or more steps, more than one or two steps to go into your house, it's very long to require a ramp. So most people are like, oh, I have 5 steps, but I'll just get a ramp when I need it. Foot of length for every inch of elevation for a ramp. Okay, that means if you have 2 steps, you're talking probably about a 12-foot ramp. That's long. Most people don't have that kind of space. So for every step, you add another 6 inches step on average, 6 inches. That means another 6 feet of ramp. All right, so make a plan if that is your situation. High beds, hard to get into and out of, especially for our women, as we tend to get really little as we get older. I will most likely be under 5 foot before I am leaving this world, so I need a lower bed. It is easy to lower a bed if you have a 7 to 9 inch box spring. That's what your average box spring is 7 or 9 inches. There are low-profile platforms. You can just switch that out, right? You can get 2, 4, or 5 inch easily available in lots of different ways. So that's one easy way of lowering that bed. And then finally, There are so many things that we can do for bathtubs and showers and stuff. I'm not even going to start to get into that. It's very individual where those grab bars go. Location, location, location. It is very individual. What I will say is an easy way to decrease the slipperiness is to add some slip doctor solution. You can get that on Amazon to the bottom of your tub or your shower, and to avoid suction cup grab bars. If you know you need a grab bar, we need to get those installed and not use suction cup. All right, any questions about this stuff? And then I'm going to pass it on to Amy, who is going to talk about balance and exercises. She's an amazing physical therapist with Synapse. Yes?
Just one question, like,
yeah.
in your experience, plan ahead versus crisis, where do you think your pendulum lies? Is it 50-50 people plan and execute, or is it more like wait till a crisis and then figure it out?
In my experience, I mean, I am an OT in this area, so I'm going to get called in a crisis more. So I personally get called in the crises.
But
in my overall, I think most people do not plan ahead.
Okay.
I have a good friend who's 65 years old, one of my very, very, very best friends, 65 years old. She just moved into a townhome with 3 flights of stairs, her bedroom at the top. And I said,
why would you do that?
Carol, why? And her partner is about 67.
Is it just because we don't think we're age in our mind, or what is it?
There's
I'm trying to figure out myself when it's too old. I mean, I'm only 60. I'm thinking about it in the next 5 years.
Yeah.
65.
Yeah.
I need to be out of my house, simplified, single, bedroom on the master on the main, all that stuff, right?
Yes.
So,
that's great that you're even, and that's what I encourage people.
I'm learning from my parents and my in-laws, because
right.
they're sitting still like a frog in boiling water,
yes.
waiting for a crisis.
Yes. That I find the majority of people. So I hope as we are learning from our older parents that we will possibly make decisions and plan ahead. That's the hope. Yeah.
Wall-to-wall carpet versus hardwood. Is one better than the other?
It really depends. But what I will say is that hardwood floors are easier to mobilize on for the long term. So carpets, especially if they're thick, get more difficult if an assistive device is needed at some point. Wheelchair, very difficult on a carpet. So if you have the opportunity to remove the carpet, I would do that and honestly do an area rug for the warmth of it, right? Relatively thin, but an area rug that you can then do carpet tape around to secure the edges. That then can be removed if there are issues. But yes, wall-to-wall carpet, while nicer to fall on, it's really harder to move on, and assistive devices on wheels, very difficult. Yeah.
Another question is a comment. We had to remove, take completely out one of the doors for my mother. Because from bedroom to the bathroom, there was additional door to the bathroom shower area. So in the middle of the night, she doesn't have to open up and down, whatever. So that made it a lot easier.
Yes.
That's one. The second, about the lighting.
Yeah.
Nowadays, there are those chargeable, small
motion sensor
ones. You can put anywhere, on stairs or anywhere. The light doesn't have to stay all night.
Right.
But wherever direction you're heading, that's those two things that we found helpful.
Yeah, that's great. Thank you. Yeah, no, those are great. Yeah, doors definitely an issue. I love barn doors also. If you swing doors are very hard to manage with an assistive device, or if there's any mobility issues. So if you can remove them, that is nice. Anything else? Yeah.
If somebody's getting a little unstable and you're trying to segue them from a potential one-handed cane to, do you try to segue people to walkers or roll hours?
You know what? I think this is a perfect segue
for me.
I have and I do a lot of times work with, but I highly recommend somebody like that go and get evaluated by a physical therapist, which,
Yeah.
here you go.
Thank you. Thanks. Thank you, Cindy. I always learn something when I listen to one of your talks.
That's good.
Cindy's amazing, if you guys haven't. Yes.
Thank you. All right.
Thank you.
Think.
Awesome. Okay, let me do it. Oh gosh, I can't see it. Hold on. How are you guys doing tonight? Try to keep my notes out of this. Oh, hold on. Slideshow. Play from the start. There we go. Okay, my name's Amy. Hi. I am a physical therapist. I co-own and treat at a clinic named Synapse Neuro Rehab and Wellness. We're in Sandy Springs. We primarily see people who have Parkinson's disease or other neurological issues such as post-stroke, post-brain injury, but we also see people for just general balance. So here I am, and I am going to talk to you guys about what it means to have good balance. Balance is something that is automatic in our bodies, right? And we'll talk about what that process is in a couple of slides. But we typically don't think much about balance until we start to lose it, right? How many people in here feel like they have amazing balance? Like you can do anything and don't really think about it, right? Good. How many of you are like, I start to feel I'm a little unsteady in certain areas and places? Right, good. And how many people, and you don't have to raise your hand, just curious, but how many people would say you don't have great balance and you've had maybe a fall or something unstable where you couldn't catch yourself? Okay. So we're going to get into what all of this means. We're going to learn about the different types of balance. Balance is very complex. So when somebody comes to me and I'm like, what is your goal? And they're like, well, I just want to have good balance. We really have to dig into the different parts of what that means, right? And so I'm going to give you guys some more directions. So if and when you do go see a physical therapist for balance, you can be very specific and give very specific examples or patterns, and then your physical therapist will do some tests and give you exercises and activities to hit that certain part of balance that you're having trouble with. We want to review why balance is beneficial. Cindy did a wonderful job of doing that. I will probably repeat a little bit of what she mentioned earlier. We're going to learn the role of strength in balance, because strength, how strong we are and how balanced we are, go hand in hand. We have to have optimal hip and ankle strength and core strength to have good balance and to maintain good balance. So these are called the powerful pair. And then we're going to participate in balance exercises and what you guys need to do next. Okay. So what is balance? It is our ability to control our body's position over base of support. So when we talk about balance in the PT world, there are some key terms that we use. So our center of mass is the area in our body where the mass is equally balanced. So when we're quietly sitting, or as I'm standing here, my center of mass is just below my belly button, okay? And then that changes depending on if I'm reaching, or if I'm bending over to get something, or up on my tiptoes. The center of mass changes. Our base of support is, if we're sitting, our base of support is our hips and our thighs. If we're standing, our base of support is our feet. And if we're doing a handstand, then our base of support is our hands. So our limit of stability is how far we can move our center of mass over our base of support. So if we stand really narrow, our base of support is really small. our limit of stability is really small. I can't reach very far or bend down and reach very far before I have to take a step, right? So my limit of stability, when my base of support is narrow, is small. But when I stand with a little bit of a wider base of support, or even in some areas in therapy, we teach people to stand with a staggered base of support, I'm able to reach a lot farther with better balance before I have to take a step. And we're going to talk about all of that in just a second too. But the key takeaway from here is when your base of support is wider, you are generally going to be more balanced. Okay, especially when you're doing things with your arms or turning your head. So like I mentioned earlier, the balance process is very complex. We're just, next to this slide and the next slide, it's very simple. But it's pretty cool too. It's like our brains and our bodies are really amazing what it does for us. So basically, sensory information comes in by way of our eyes, our inner ear, and then we have little receptors in our joints and our muscles. So that information comes in from our environment to a part of our brain that's the central sensory processing system. It comes in through our spinal cord, our brainstem, and then it's like right here in our brain. That's the central sensory processing area, which then talks to our central motor area through neurons and electricity and all of this crazy stuff. And what comes out is messages from the motor area about how to move our limbs in response to the sensory information that has come in. And all of this happens in less than milliseconds, right? If you can imagine that. So you're stepping up to maybe like a curb or a grassy surface. Our brains see, our visual system sees that grass, processes in the brain, and it automatically makes adjustments in our bodies to be able to balance on that grassy surface. And we don't even think about it. It's just automatically happening so fast. Pretty cool, right? Yeah. So different types of balance. So static balance, and we're going to practice all of these towards the end. We call static balance balance that occurs in quiet sitting or standing. So when you're just standing doing something at the kitchen counter, or standing getting dressed, or standing and brushing your teeth, or sitting on the edge of your chair reading a book, but maybe you don't have a back against anything, that's called static balance. Anytime we're moving, walking, running, stepping up, stepping down, turning, that's called dynamic balance. In certain conditions, like a lot of people with Parkinson's, their dynamic balance is more affected than static balance, except for when you have your eyes closed. There's different, like if you have neuropathy of your feet, your static balance might be worse than your dynamic balance. So there are different conditions that cause one to be more affected than the other, but it's important to know the definitions of both. So static is quietly standing, dynamic is when we're actually moving our feet. So what keeps us upright? We have strategies. And again, all of this is automatic. All of this happens so fast, we don't think about it. So one strategy is our anticipatory balance strategy. I want to call it reaction. It's not. It is how we prepare to step up onto that curb, for example. So our visual system sees the curb, it computes to our brain it takes in the information as to how high it is. The brain computes based on what the visual system sees, and then it tells us how high we need to lift our foot so we don't trip on the curb. That's an example of anticipatory balance. Another example would be if you're standing and you go to pick up like a heavy suitcase. Your brain is already preparing your body to engage the correct muscles that you need to engage to pick up that suitcase and not fall over because it's too heavy. Okay, so we're anticipating what we need for center of mass over base of support. We then have reflexive balance. And I'm going to actually skip that one because reflexive and reactive are very similar. So I'm going to put those in the same category. The reflexive and the reactive balance are the balance reactions that we might be more aware of. So if you ever have had a slip or have tripped, or if you're in a crowd and somebody accidentally nudges you, maybe you take a step. Do you guys recognize yourselves doing that to catch yourself? And that's pretty normal. That is one of our balance reactions. So we actually have grades of reactions. If the perturbation is small, our ankles will fire. So if you ever feel maybe, you might not even realize you're off balance, but maybe your toes come up and you don't realize it, that's a balance reaction. Okay, or maybe a bigger reaction to a bigger perturbation would be you move at the hip, or maybe you go up like this more so. Okay, if you're on an uneven surface and maybe you feel like you're swaying, does anybody ever have you experienced that at all? You feel that sway? Those are balance reactions that are holding you upright. Those are good. Right? Because I have a lot of patients that are like standing on our foam surface and they've got their eyes closed and they're swaying and they're scared to death because it doesn't feel good. But I'm like, no, those are your balance reactions. Those are keeping you safe. If you didn't have those, you would fall over like a tree in the woods, right? And then our large reaction, just like we talked about, if the perturbation is so large that we can't get it from just our muscles and our ankles and our hips, then we step. I call it our kickstand, okay? And it's a reaction. So if you trip on something, you take a big step forward like a kickstand to stop yourself, stop your momentum from continuing to go. Does everybody can see that? Yeah. So some factors that influence our balance. We're going to dig more into the sensory orientation in a minute. Limit of stability we already covered. If your limit of stability is small, then you have a greater chance of needing to use your balance reactions, or you may have a greater chance of losing your balance. So keeping that limit of stability big with a wider base of support. So standing with a little bit wider feet or that staggered stance. Biomechanical constraints we're going to talk about more. So cognition can influence our balance because not only is balance, it's visual, vestibular, joint receptors, our environment, but we have to be aware of our surroundings and we have to be able to make good decisions and assess risk and reward about what we want to do as far as knowing our balance limitations. So cognition is important. Fear is important. Environment, like we talked about, very important. Medical history, age, history of falls, because just as Cindy mentioned, if you have one fall, the fear sets in. You might become more sedentary because you're afraid of falling, and that might lead to more falls. Or if you've fallen, people don't get therapy after they've fallen. They may just become more generally weaker, or if you've had an injury from a fall. Current physical activity level, and then medications, as Cindy had mentioned. They all contribute to balance. So vision, we've touched on this a little bit, but our visual system detects objects that require navigation in the environment and in relation to ourselves and objects, okay? So where am I? You've got to navigate around stuff on the floor, but we don't have clutter in the floor anymore because we've picked it up. But before we had to navigate ourselves around the clutter, the visual system tells us how far we need to stay away from the clutter so we don't trip on it, right? The vision is critical for anticipatory balance. And interestingly enough, as we get older, we are more visually reliant on our, for balance, because our inner ear and our joint receptor sensitivity decreases as we age. Well, so does the visual system though, right? But as we get older, we rely a lot more on our vision for balance than the other two systems. Our vestibular system, that's our inner ear. It provides our brain feedback about the position and the motion of our head. So anytime the vestibular system is involved, it's when we're walking and we're turning our head to look at our environment or talk to our friend. It's also weighted a lot when when we are stationary in like a moving vehicle. So has anybody ridden the plane train at the Atlanta airport? Terrifying, right? Like, hold on, or you're something. I rode it the last time and I was like, oh my goodness, they are not joking. But yes, so anytime you're on a moving, like a boat, anything like that, and your body's stationary and the environment is moving around you, that's your inner ear giving your brain feedback about where your body is on this moving object. Okay? It also allows us to fixate our gaze on something while our body moves. So have any of you, well, we probably all watched the Olympic gymnastics last summer, right? And how they can do all of those crazy tricks and spin in the air and not lose their balance is because they're fixating their gaze on something. And so that's their inner ear. And so when Simone Biles, I don't know how many, not this past Olympics, but the one before that or two, when she lost, when all that happened and she lost her point in space, that's what happened. She lost her gaze stability on her wherever they train her gaze to be. And so her brain didn't know where she was in space. And that for a gymnast moving like that, that's very dangerous. So that's all inner ear that does that. Okay. And then we call it the somatosensory system. These are the receptors in our joints, our tendons, our ligaments, and muscles, which provide information regarding the length of our muscles, the tension in our muscles, pain, temperature, stretch. And it's all of that is very dominant for upright postural control. Our feet and our ankles have a lot of receptors in them. So what are biomechanical constraints? Biomechanical constraints are other areas that impact balance, right? If we have tightness or weakness in our ankles, that can contribute to poor balance. If we have weakness in our hips, that can contribute to poor balance, or in our core. Our posture, if it's stooping too far over, then our center of mass is very forward, so we're more likely to lose our balance forwards. In my clinic, we have people with poor posture who try to upright their posture, but they can't because they're fixed, so they lean backwards on their heels to try to fix it, and then that causes loss of balance backwards. So we do a lot of work on posture and stacking, because that is so important for balance. Peripheral neuropathy, that is a condition that causes decreased sensation in the feet, and that's where a lot of our receptors are, so we need sensation in the feet. Muscular endurance, and then abnormal muscle tone. So biomechanical constraints have a lot to do with the musculoskeletal system. Cognition. So we need attention, insight, judgment, and processing for good balance. Attentional deficits may reduce awareness of environmental hazards. So somebody just, might not be paying attention and not see something and trip, right? We talk a lot about in my clinic, if you have some balance problems, to just be mindful of what we call dual tasking during walking. So just try to focus on walking, not talking on the cell phone at the same time or texting or even carrying items, because the brain will pay more attention to what's happening in this secondary task than it will to the walking and the environment. So if you do have some history of imbalance or some falls, maybe just do mindful walking, and the secondary task can happen when you get to your destination. Does that make sense? Because you want to pay attention as much as possible. Yeah. Do you have
Text and walk.
No texting and walking, yeah. Just like texting and driving. Don't do that. Memory loss may make recalling safety measures difficult. Depression, agitation, and denial of impairments will increase fall risk. And then we just talked about dual tasking. So that's what the balance weighting is. Fear of falling. I'm going to skip this because we've already talked about it. Environment, much like Cindy said. So what I talk to my patients about, especially if they've had a fall or they have imbalance, decreasing fall risk is both in a recovery with the body. So you come to therapy or you do exercise to get stronger, to maintain your strength or your balance system. So that's the recovery, that's the internal part. And then we have the compensation part, and the external part is what Cindy just mentioned, and that is setting your environment up for success as well. So you come to therapy, you do the exercises to change and get stronger internally for better balance, and then you set up your environment externally for better balance as well. So uneven surfaces, stairs, ramps, thresholds, curbs, clutter, icy and wet surfaces can lead to imbalance. Narrow spaces, especially if you have Parkinson's, that can lead to imbalance. Carpets, rugs, runners, other people, crowds, animals that are in the way, and then visual or auditory distractions, especially if you have some balance problems while you're dual tasking. Say try to limit the auditory distractions when you're moving through the house, things like that. So aging and balance. So balance begins to decline around the age of 50. And then older adults become more visually reliant due to a decline in the sensory systems, the other sensory systems we talked about. Decrease in muscle strength and flexibility also contribute to a decline in balance. And then as we get older, our reaction times are slower, and sometimes our judgment of our environment is off a little bit. Sometimes we also think we can do things we did 20 years ago, and that falls into the judgment part too. So, but the good news is with the internal work and the external work, falls don't have to be a thing. Falls are not a normal part of aging, okay? So, how do we maintain or improve our balance? With consistent and regular strength and balance training. So when we think about exercise, what do we think about?
Going for a stroll.
Going for a stroll, walking. What else? Lifting weights, yeah. Stretching. We don't often think, oh, I need to do my balance exercises, right? Unless you've been in physical therapy and your therapist is telling you to do them. But I don't even know if they're part of the ACSM guidelines or balance exercises, but they need to be. So we need consistent and regular strength and balance training. You need to keep a general active lifestyle. Regular vision checks, medication reviews, home safety modifications, and then risk assessment. So let's talk really quickly about the role of strength in balance. The stronger our muscles are, particularly in our feet, our ankles, our knees, our hips, and our core, will help prevent falls because it allows us to have faster reactive times. So those balance reactions, we need to keep those top notch, and how we do that is to stay strong, right? Strength in these areas, our hips, our glutes, and our core, are really important in posture as well. And so we know that posture plays a big role in staying in good balance. It also, training can prevent other injuries that may keep you sedentary for longer. It can address low back pain. It can address hip problems. It's certainly very important after like a surgery that you've had to get back into strength training. Anything we can do to avoid that sedentary lifestyle. And I just want to say, if you're not, how many of you are exercising right now regularly? I'm so impressed. Good job. If you're not, it's not too late to start, okay? And I'm just going to give you guidelines. If you're not doing this exact thing, that's okay. Maybe there's room for improvement, but I always say doing something is better than doing nothing, okay? So general guidelines for strength training. 2 to 3 days a week for each major muscle group, with the emphasis on postural muscles, which is our backside, our core, our glutes, our hips, and our ankles. Okay? 10 to 12 repetitions of each. And I don't this is the ACSM guidelines, 40 to 70% of max RM, but like who really knows that? What I typically say is the weights, or the amount of weight that you are lifting, or the reps you are doing, or it should start to get hard around if you're doing 10, it should start to get hard around rep 7. If it's easy and you can do like 15 reps of something, you need to increase the weight or increase the band or change the body position so that it's hard, okay? So yeah, if you can do 15 or more reps of something, the weight is not heavy enough. You need to allow at least 48 hours of rest between strength training. And some examples, you can use machines at the gym. You can do a great body weight workout. You can do those resistance bands, the colored bands, dumbbells, barbells, kettlebells, whatever you want to do. Lots of options for strength training. And then guidelines for balance training, focused balance training, 2 to 3 days a week or 60 minutes a week. And we'll talk about how to include it just into your daily routine too, because I know we have limited time, right? You need to include static, dynamic, coordination, and then visual and vestibular components, which I'm going to teach you today. So some examples of balance training, yoga. Does anybody do yoga in here? I love yoga for all the reasons. Strength training, postural training, balance training, nervous system regulation, breath work. Yoga's great. Tai Chi is another one that's great for balance. And then functional movements and physical therapy, which we'll talk about more. Okay, so let's save the practice for the end. So what do we do now? So if you haven't already started an exercise program, which most of you have, go ahead and we need to talk about starting one. You also might want to talk about or think about where you need to alter it to include balance exercises. And I'm going to show you some balance exercises in a minute. Consider being evaluated by a physical therapist for a comprehensive balance strength program. So a physical therapist, we have a crazy balance test. It's called the mini best test. There's 28 items on there, and it breaks down the item by each category and more of what I just mentioned, of all the different types of balance and reactive, anticipatory, sensory integration, all this stuff. So we can see, along with what you tell us, where your problem is. And then we address that, as well as give you a general program as well to keep all of the other areas strong. Okay, if you or your loved one needs, or you think you might need, an assistive device, you probably should see a physical therapist. Did you have the question about the assistive device? Okay, yeah, because there's so many factors that go into that. There are different types of canes, but there are also different types of walkers. And do you need a seat with the walker, or brakes, or do you have carpet, hardwoods, things like that in the house? And then there's the training with the assistive device. They have to be certain heights. You have to be certain distances from them, teaching you how to take it up a curb and down, stuff like that. So it's better just to get an order from your doctor and come and get a couple sessions. And then contemplate where you can throw in balance snacks throughout your day. And as I take you through some of the balance exercises, you'll see what I mean by balance snacks. So for example, if you're brushing your teeth, maybe you stand on a tightrope and do that. Or if you're real good, maybe you stand on one leg and brush your teeth. If you're doing dishes at the sink, maybe you stand on a tightrope. You're going to have your hands in there too, so it's not 100% all the way, but you've got something going on with your feet. Okay. So do I have 5 more minutes? Oh, we got to get practicing. Okay, everybody stand up, put your chairs in, get behind your chair. If you have balance problems or imbalance, feel free today to use the back of the chair lightly with your hands. Or if you feel wobbly, but you're not going to lose your balance, that wobbly is good. The sway is good. Okay, so we're going to do some static balance. So everybody is statically balanced right now. So because we're short on time, we're going to jump ahead. Put your feet all the way together. Make your base of support very small. It feels different, doesn't it? Okay. All right, now with your eyes open, I want you to turn your head to the right and back to the center. Now turn your head to the left. Now turn your head all the way to the right. And now all the way to the left. Don't go to the center and back to the middle. Did you guys feel the difference? What did you feel? A little more sway. Your reactions kicked in. Good. Okay, now what I want you to do is close your eyes. So now we're taking the visual system out of it. And so if you come to therapy with me, we would spend a lot more time on each one of these, but I'm just giving you little snacks right now. Okay, closing your eyes. Now, if you feel like you're swaying here, stay here. If you need more, keep your eyes closed and turn your head to the right. Turn your head to the left. Turn your head up to the ceiling. Down to the floor. Good, back to the center. Whoa, I got a whoa. Yes, I did my job. Okay, so that's even more challenging, right? Because we just took our visual system out of it, and then we challenged our inner ear. So now the only thing we're really relying on is our little joint receptors. So they're getting a little workout. And okay, so let's do another static example. So either put your feet like a tightrope. If that's too challenging, do a balance beam. So do heel beside your toe. Okay, now you're going to take your left arm, you're going to reach to the left as you turn your head to the left and reach as far as you can go. Oh, I'm not mirroring you. Turn your head to the left and reach to the left as far as you can go. Good, come back to the middle. Hold your chairs. Okay, now take your right hand, and I'm opposite of you. Turn your head to the right. If that's all this, if you're swaying a lot right here, just don't reach. Now reach to the right. Woo, Oh, it got us, didn't it? Okay, and then you can practice with your other foot in front. Okay, because we're so short on time. I'm sorry. We won't do dynamic, but dynamic balance is things like marching or sidestepping. It's things like jogging. It's things like walking and turning your head, or walking with your eyes closed and then open, closed and then open. Okay. Let's do one more. So this is actually a test. You guys like to be tested. Now this is the hardest one. So use the chair if you need it. You're all going to stand on your right leg for as long as you can. And if you wobble around, those are your balance reactions. So thank those, because you want those. If you are wobbling here, stay here. If you are still as a statue, turn your head up and right. Okay, turn your head down and left. So these are the kind of things that you want to practice. And you can go ahead and sit down. You're not going to be 100% at this, because I just did not grade. We didn't start simple. We went to the very hardest thing, and through all your balance systems, got all of them unstable. But doing things like narrow base of support, standing on a tightrope, standing on one leg, those are great additions to your exercise program or snacks around your house. Marching, sidestepping, practicing walking and turning your head to the right or turn your head to the left, those are also great additions. Okay? Do we have time for questions? Okay. Does anybody have any questions? Yes.
Can you talk about getting up from a chair?
Getting up from a chair. I can. Do you have a specific, like how?
How to?
Okay. Yeah. So there are 3 steps. 3 steps to getting up from a chair. You got to get to the edge first, right? And get the couch, recliner, whatever. Get to the edge. Your feet need to go back so that your toes are under your knees. This is what I see a lot. I see people's feet are out here. Guess what? Nobody can get up from that. Okay? So feet have to be back. The lower the surface, the further back the feet have to go. Okay? And your feet need to be apart, because why?
Stability.
Guys are good. You're good. Yes, balance and stability, good base of support. And then you've got to lean. So whether or not you have your hands on the armrest, that's fine, or no hands, you have to lean your chest over your toes and stand up. Because guess what? The center of your mass, which is up here, has to go over your base of support to stand. So what I see in the clinic is either feet are out here, can't get up, or people don't lean. And then you try to just go up like a helicopter. That doesn't work. Okay, unless you're super strong in those legs. So feet back, lean forward. If you lean forward enough, you'll feel your hips pop up from the chair, and then you can use your legs. Does that answer? Okay. Does anybody else have a question? Yeah.
Vision is important. How about the person already started losing vision?
Losing vision. So that's when it's really important for the home to be changed for success, and like make sure there's not clutter or obstacles in the pathway. That's also when it's important to strengthen the other balance systems, the inner ear and the joint receptors. So when I have a person that has low vision, and I train everybody low vision, because we all have to get up in the middle of the night and go to the bathroom. It's dark, maybe we're carrying something in our hands. We can't see our feet or the ground. So I would do a lot of eyes closed activities to strengthen the inner ear and the other balance systems. But the environment change is going to be really important for that. And yeah, depending on how low the vision gets, there's some programs and training that you can do as far as being a caregiver for someone with low vision. Yeah. Is anybody else?
How can a person call for help if they fall? Is there a program funded by Medicare for that? Alert system?
So no, there's not. A couple things, and then Cindy, you probably know this actually more than me. You can call the fire department now.
I mean, if the elder's by themselves.
Oh, so go ahead,
So
Cindy.
unfortunately, nothing is covered by Medicare and no fall detection devices. What I tell people is there's lots of different options out there now. If somebody is already an Apple user or smartphone user, then you can. The Apple Watch does have fall detection capability. It would also presumably have GPS capability. But that is really only for someone who really already is an Apple user, so is kind of used to the Apple system. Medical alert or fall detection devices, there is a monthly fee, but there are different in ranges. There's a couple companies I recommend, but there's lots of them out there. And then it depends totally on what you or your loved one needs. Do you need just an in-home versus one if you're out? There's different prices, watches versus necklaces. And then where things have improved is in the sensor systems. There are some sensors out there that are starting to detect changes to where somebody has fallen and there'll be an alert sent to like an app. If it's your mom who has fallen, then there can be an alert sent to you that something is off. So those sensor systems that because people don't love to have to wear some type of device, they are improving. And that is where AI is really, I think, going to change how this is looked at and done. But those are kind of your basic three options.
Mom's home monitoring system, they offer a little file as well, just kind of linked to the alarm. And she also had a remote for the garage door opener, because if she fell, you have to tear the front door down to get to it. That's not quite that easy. So.
What I also tell people, if they're used to Alexa, right? I have a client, if they have like a Google Home computer, like a Google Show, or even just the Alexa Dots, if they're home alone, they can say, Alexa, call my husband if they've fallen. Or I don't think Alexa will call 911. That may have changed, or there's something you can add to that it does, because they didn't want that for obvious reasons. But so that's one thing people will use a lot. But it is definitely something to think about, is home alone, what are you going to do?
Yeah.
Yeah, I just wanted to add to that the initial part about what Medicare paid for it. Medicare won't, but a person who's eligible for Medicaid services at home through SOURCE and CCSP waiver programs, they will provide a paid for emergency call pendant for people that are within their program. You got to go through their hoops and bells and whistles to get services in the home that are subsidized by Medicaid through SOURCE and CCSP, and they'll pay for that emergency fund.
I like that, Alexa. My mom had them in every room. It's so annoying, but you can broadcast messages. I'd like some hot chocolate. I want a hot chocolate too. So it was really helpful.
That's funny. Yeah.
Thank you. I love all the tips. But
Yeah.
my struggle with my parents is stagnation.
Keeping them
to
there.
even get them to do any of those tips or exercises is a struggle.
Yeah.
So anything that help motivate
So
on the couch or
finding a group fitness class for seniors, either Silver Sneakers or the YMCA. I think Silver Sneakers is in a lot of the Ys, but the YMCA's have classes for people with Parkinson's, and that's for everyone can join that. We have a fitness center next door to us. It's called the Center for Movement Challenges. People can come. We do group fitness classes. So I would say go that route first. Try to find a group class at least once or twice a week. Usually,
Right.
yeah. I mean, there's only so much you can do, right? Which is also, yeah. Exactly. Or I don't know if they're goal oriented, get them a pedometer and have them count their steps every day and start the bar low. Like, let's get 2,000 steps today, and then in a couple weeks, kind of depends. We can figure like individual stuff more out after the program if you want. But yeah, that's the motivation piece is hard, right? And I tell people a lot of times, don't wait until you're motivated to do this stuff, because you won't, you've got to be disciplined to do it, right? Because exercise is, some people love it, some people don't.
Just stand up during a commercial. She loves to watch TV. So just stand up.
Yeah.
Just stand up.
Just stand up.
Once every time a commercial comes out.
Yeah.
That's it. And that was all right.
Yep. Oh, the Benton Center.
They have exercise.
Okay.
They have different advantages to where someone who doesn't want to just go for exercise and then they have food, they have lunch, so it becomes a social.
Yeah.
Exercise group, and it has become a social over 15 or more years,
Yeah.
20 years, and so then you make friends, and it's someplace you really want to go. But the Benson Center could very well be a start, and there may be something similar to that.
Okay.
What was the first part I missed?
The Benson Center. So it's in Sandy Springs. It's actually right across from my clinic. It's over in Sandy Springs.
They have to be in Fulton County.
I don't know. Do you have to be in Fulton County for that? DeKalb or Fulton?
Us DeKalb people.
Yes, it's a collaborative.
I'll let you.
That county, I don't think it's very expensive.
Like a $10, $15.
But they may have that in other counties too, that gets you out of the house, gets you social.
Yeah.
Yeah.
That's important.
It'd be great fun.
Yeah.
That's a good start.
There are several other DeKalb senior centers around. There's one in Chamblee. There's one in, close to the Emory campus. There's several other DeKalb if you're not close to Sandy Springs. And North Fulton has several too.
Good. That's good.
Anybody mentioned Silver Sneakers?
Silver Sneakers, yeah. Yeah, they're pretty much all over the city too. So that's a good group as
That's
well.
the ultimate goal.
Yeah. Yeah.
The food aspect might be
Mall
the
walk.
start.
I think it still happens.
It does?
Yeah.
Okay.
Yeah. All right.
All right.
Well, thank you.
Thank you.
Thanks. Thank you. It was good to talk to you guys.